Leo niko na a good friend of mine, so nilikuwa nataka ajiintroduce, atuambie ni nani, ametoka wapi, anafanya nini na what she has for us today. So karibu sana ndani ya Tubanje Show. My name is Melissa.
Hi Melissa, and thank you for the invite. My name is Kinya Nina, rather Kinya Gitonga. I am a mental health advocate. I am also a psychologist. I am a lot of things. But right now, I am an author to these materials that speak about mental wellness. Other than that, I am also a student counselor at the University of Nairobi. And I am the sitting chair and founder to Sound Mental Health, which is a youth-led forum. And in Sound Mental Health, we try to create awareness, basically on what mental health is and how can we manage stigma surrounding mental health.
So welcome to our YouTube channel. I'm the co-host. I'm the host of the show. Inaitwa Tubanje Show. We just advocate. We just educate. Tuseme tu ni freestyle. So feel free.
Thank you.
Yeah. So we wanna talk about mental health. Sasa jue ni psychologist. Unafaa utueleze msee akiwa na mental health. Anafaa kutake measures kama gani? Yeah. For example, mimi umenipata niko na mental health issues. First step, nini unafaa kuni advise nifanye? Yeah.
Okay, so when we are talking about mental health, we basically are talking about the state of your mind. And as we know, once your mind is affected, it will definitely affect the way you act, the way you behave, the way you interact with other people. And that means kama ni job, ama ni home, your relations with other people, they are interfered with. And so when you're talking about mental health, it is very important to know we cannot say it is an issue until it starts affecting the way you work, the way you relate with others, until it starts affecting your rhythm of life. So every time that you're talking about mental health disorders, we have to see over the past 2 weeks, over the few days, how have you been relating, how are your emotions, how are you relating to other people, and also work. And every time that you have a person who has mental health disorders, we have to really check how are they feeling, how are they relating. And basically kitu ya kwanza yenye you change whenever you always have an issue, utaona your normal life ni kama imekuwa interfered with. Kama ni ule msee unapenda kuongea na watu wengine, kuinteract, your interactions unasikia no, I just don't want to go out anymore. Maybe utapata kama you like eating, you don't have appetite at all. If you love sleeping, utapata your sleeping pattern pia zimekuwa interfered with. And what we normally do, we have to assess first tuone kama ni depression. Is it really depression? Kama ni eating disorder, is it really eating disorder? And so for most of the cases, we normally advocate for therapy. And when I'm talking about therapy, most of the people have ile ya naambia counselor mashida zangu. But it's not like it's a whole issue. We really want to help you out. We really want you to have your normal life back. And so it is more of helping you out of the situation that you're in. And also if it is too diverse, we can advocate for medications. Juu kuna zile cases zenye you cannot only do counseling na ishi hapo. You have to see a psychiatrist, atakupatia madawa, and at the end of the day you'll be fine.
So they say mental health may be positive or negative. So nyinyi mna consider sana na ile negative ama pia mnaangalianga pia ile positive?
Mental health, or rather mental wellness, it's a whole round thing. So when we're looking at the positive bit of mental health, tunaangalia pale penye you don't have an issue at all. If it is work, you can relate with your colleagues well. If it is productivity, you're good to go. If it is school, you can concentrate, you can recall, and that is okay. But when now we are looking at the mental health disorders or mental health illnesses, that is when we'll see about the negative.
The negative side. Okay.
Yes. But seeing a counselor doesn't mean you necessarily have to have had a mental health issue. Maybe you're getting married and it's a whole different thing. I know it is positive. Also
I think that's also tuseme hiyo tu maybe ni kama tu mental health. Maybe uko na ile uko anxious kujua what happens. Yeah, vitu kama hizo ama ujipate umeingia kwa ndoa na what utafanya next. Yes, unataka kuoa but ujui nini na happen kwa ndoa.
Yes.
Sasa unapatanga people are being advised to go and seek a counselor before getting married. But as Africans, we just ignore, we don't go to counselors. Unapata ndoa mingi mtu wa watu wameona vizuri, wakidate walikuwa poa, but venye wameingia tu kwa ndoa hivi hawaelewani.
So there's a positive bit, and we call it eustress, because it is positive stress which is necessary. Maybe you're also planning a graduation, the events planning, maybe the guests that you want to invite, everything that stresses you out, but it is positive. There's also examinations. It's a whole new thing, kufanya exams na kupatia stress, but at the end of the day it is something good for you because you are progressing from one level to the next. So there's also the eustress, which is positive, but it is important because now if you don't feel the stress, you will never study.
You never study. You just feel comfortable, mambo yako tuko tu sawa. So umeandika kitabu imeandikwa The House of Hunger. We understand when a person has a bit mental disorders, kuna watu wenye upishikwa na hasira. Maybe umse ana kazi na amepita mahali, unapata wasee wanafurahia naye bado ako na stress. Leo nimezunguka sana huku town, nitapataje kazi? Umse ako na anger issues. When you talk to him or her, hata maybe anaweza kupiga na wewe huku ana any beef na yeye. So can you explain more further about your book? Na the meanings and tueleze tu about anger issues juu mostly when someone has mental health issues, most of the people got anger issues.
Anger is one of the underlying issues. Anger, whenever we're talking about anger, it is one of the underlying factors in most of the mental health conditions. And you find that when someone is angry or they have anger issues, they are so irritable. Pengine haujamkosea, hata humjui, you're so jovial, just want to say hi. And whenever you greet them, the way they respond, or maybe they might ignore you, you are like, I've not done anything wrong. What is wrong with you? Why are you not saying hi to me? And maybe even at work, you must find a lot of people with anger issues, you project the emotions to other people. And that is now why I decided to write about The House of Hunger. It is to create awareness, not only to youth, but to people of all ages. So it is a book that cuts across all the target audiences, students, non-students, because you see that anger affects all spheres of life. Anger will affect the way you relate with other people. It will affect your productivity at work. It will also affect probably students who are schooling, because now you're also angry that the lecturer came late. You're also angry maybe because your computer is not starting and the exam has already started. And you see, there are people who have issues with managing their anger, and that's now disrupt their whole rhythm of life. And so when I wrote about anger, I wanted to create awareness to a lot of people, because you may find in communities, especially in rural areas, people who always praise that person who has issues with controlling anger. They're like, so-and-so is untouchable. So-and-so, whenever they're angry, we cannot talk to them. Or maybe we cannot
fear them.
Yes. But it's not a nice thing to have people shy away from talking to you. Because maybe you have a child and they want to tell you something and they cannot because you're angry. And when I also wrote about Thrive, I was trying to create awareness on the issues we're facing as young adults. And so how do you get to thrive within all financial crisis? Because adulting is a whole new thing. You have school, you want to balance work and school, you want to balance your social interactions and everything. And it's a whole different crisis. And so how do you get to thrive within all those new things? So that's why I wrote Thrive. And it is also a book that normally cuts across all spheres and all audiences. And so my love of writing, I loved writing more as a way of voicing out.
Creating awareness.
Yes, you don't have to be 40 to start writing books. You don't have to retire to start writing books. You can write books to create people, sensitize them on mental health, and do a whole new thing as a youth.
So to these people who have anger issues, how do they control them? Do you find kuna wase wanapenda kukasirika tu bure, like mtu anapenda kukasirika tu bure, vitu tu ndogo ndogo zinapenda tu kumkasirisha, na unapata amekasirika tu kabisa, hata whenever you try to explain to him or her, ataki kusikia anything. So just give us ways of how people can control their anger issues.
All right. I won't say so much because I'll be spoiling. We are actually launching this book on July 29th.
Okay.
And so for those who might be able to come across this video and maybe you have issues with anger management, you can always book a copy of this book through my socials at Kinya Gitonga.
This one, the House of Anger?
Yes.
Okay.
It goes at 500 before the launch, and after the launch, of course, the price will hike.
So for now you're selling it for 500, then after the launch the price will go high.
Yeah. But on a little note on anger management, how do you get to control your anger? There's something that we call timeout. Maybe you're talking to your partner and all of a sudden they just take you off and you're so angry, you cannot control emotions, you just want to shout, yell. You can walk away. We call it time out.
Okay.
You walk away. Maybe you can take a walk. Maybe you can go to friends whom you feel they are appealing at the moment. And that will help you calm down your nerves, calm down your emotions. And then you can reason now better. So you can get back and talk about the issue that you guys had when you're more calm. And you normally say that you do not have to make decisions when you're angry, because then you won't be able to make the right decisions. And so walking out is quite good. We also say you can listen to music, soothing music that you would like. You can also write down whatever is making you angry. Yes. And you can also talk to people. Maybe someone has angered you and they did not know you're angry. Maybe your partner always comes home when you've already cooked food, it's cold, and you're so angry because they do not appreciate your efforts.
Okay.
But then they do not know that you don't like that. You've never told them. So you need to voice out whatever you're feeling to let them know you don't like the way they do things, and maybe they can change. And also, whenever we're talking about anger, there's something that we call cognitive behavioral therapy. And now whenever we are talking about behavior, it always links with your cognition. Cognition, it's about thinking, it's about memory. So there's always psychologists or counselors, they can help you restructure your whole thinking. Maybe every time kwa jamu unakasirika sababu gari haisongi.
Ama dere unaona the car is not moving.
Yes.
But hii ni gari na gani nimeingia.
Yeah, but you don't always have to get angry. So we have to help you change your thinking, restructure the negative thought into a more positive one. So maybe when you're sitting there, you can get a book and start reading. Maybe you can listen to music. And by the time you notice, you're already in town. So there's all things. There are a lot of approaches to managing anger, but also you have to understand what is causing you to get angry. Because a lot of time you're fixing things, but you're not looking at what is bringing all these issues. So with this book, you can get a whole new dimension of what anger is, how does it affect you, and also how you can manage.
Oh, so thank you so much. I hope we have learned something about anger issues. So for those people who have mental health disorders, apart from utajuaje msee ako na mental health issues apart from anger issues? Juu kuna so many types of mental health issues. So you can define for us some few. Maybe kuna mtu ako hapa nje na ajuangi maybe kama hiyo ni mental health issue na ako nayo tu inamsumbua. So you may help us know.
All right, so mental health disorders or illnesses, they are a whole range and they are a lot and it is broad. So maybe next time when we have a lot of time, we will explore it all. But basically, whatever normally affects a lot of people, you might say these issues with depression, these suicidal cases, we call this suicidal ideation. There are issues with anxiety. There's something that we call bipolar. And also attention, ADHD, we call it attention deficit hyperactive disorder. And this is where someone is so hyper. They are all over, they have issues with their concentration span. Whenever you're talking about anxiety, it is a lot of worry. They feel so nervous. They can't even settle down. Most of them, they are sweating, they are shaking. There's a lot of overthinking also. There's also something that we call trauma. Trauma, I call it stress or maybe discomfort that comes after encountering maybe something that gives you a bad experience. Maybe you are in a car crash, or probably you witnessed a house just crumbling down in front of you. It's traumatic. And when we're talking about depression, depression varies. There's something we call mania, where you are so overexcited. But then depressive, it's where now you're so low. That comes also with bipolar. And when we're talking about stress, of course, everyone can identify what stress is. That is something we call chronic stress, whereby you feel so affected with issues, and it's so much that it tampers with your body system, it tampers with the way you reason.
You may even get sick.
Yes. Now that's where we come about the effect of mental health disorders. It affects general system. You feel so exhausted. You have issues with eating, you have issues with sleeping, and there are those who now withdraw from other people. They no longer enjoy things that they used to enjoy before. So when do you know that you have an issue? When your normal system or rhythm of life gets disrupted, because we all operate in a balance. Yes. Now when your normal cycle gets disrupted, that you know something is wrong. But also people around you, they can tell, especially with depression. People can tell. They can ask you, why don't you enjoy work anymore? Why don't you want to hang out with us anymore? But a lot of people, they're in denial, like they don't want to accept this is an issue. So also it depends with whoever was identifying something is wrong. Are they patient enough to work with you this journey so that you can get to accepting this is an issue and you need to seek medication?
Okay.
Yeah.
So yeah, I think people have learned something. Thank you so much for coming, Nina. So I think director will zoom this book and it says the House of Hunger. Sijui kama director unaweza zoom. Iko sawa, inaonekana? So Nina has this book and amesema anauza for 500 shillings. Do you have a YouTube channel?
Yes, we have a YouTube channel at Sound Mental Health. You can reach out through there, but also you can reach out through my socials at Kinyagitonga, or rather at Sound Mental Health. And you can always order your copies at Nuria stores. It is at Bazaar, 11th floor. You can also visit Nuria stores via the online.
Yeah, so anyone who has mental health issues na anataka kusaidiwa, unaweza mreach kwa hizo handles zake zenye amesema, na pia tuko na kwa namba yetu ya ofisi. I think director ataiweka hapa chini. Kama unaweza manage to call, we will give you the direction, tutakupeleka. At least we want to control hiyo number of wase wako na stress, wako na mental health issues, at least ndo tuache kukuwa na hizo suicidal, tuache kuwa na wizi, juu lack of employment, vitu kama hizo. Ama ni aje, sio? I hope akikuja kwa ofisi yako utawakaribisha, utaongelesha tu vizuri. She's a good girl, interact. Yeah, she will treat you well, atakuelezea, and I hope mwenye health issues usinyamazie. We are here to help you, we are here to assist you. Yeah, so I hope mmelearn kitu kutoka kwa our visitor, na tunamwelcome sana akuje tena atueleze more about mental health issues, na we urge you to please support her, mbuy hizi vitabu na tuta appreciate sana. Na pia mwenye anataka pia kukam kwa hiyo launch yake ya vitabu, you just call our number yenye tumesema tutaweke hapo na director, tutakuelezea more zaidi. Guys, thank you so much for tuning in. We love you so much. Thank you so much. We appreciate for your support. We are road to 1,000 subscribers. Kindly don't forget to subscribe, like, comment, and share. See you on the next video. Bye bye.